Okay, guys. So this is the third recording for blood, and now I'm going to talk about blood clotting, which is a process called hemostasis. So hemostasis involves a series of 5 distinct events that will occur. This will form a gelatinous blood clot that plugs broken blood vessels, and the primary function is really to limit significant blood loss. There are 5 parts to this. Part 1 is the vascular spasm. Part 2 is what we call a platelet plug formation. Part 3 would be coagulation. This is the actual process of blood clotting. Then we have clot retraction, and then thrombolysis. So the first part, which is vascular spasms, this will begin immediately when the blood vessel is injured. And the function of this is as blood leaks into the extracellular fluid with following 2 responses. The first thing that's going to happen is you're going to get vasoconstriction. This will actually result in pressure both to act to decrease blood vessel diameter. So essentially the blood vessel is going to constrict, restricting the flow of blood to the damaged area. This allows for blood loss to be minimized as both blood pressure and blood flow are reduced locally by these local responses. So here in the picture, you can see if you have an injured blood vessel, by constricting it, you're actually going to reduce the amount of blood loss that's actually going to occur. In part 2, this is the platelet plug formation. This is essentially what we call a patch. It's consisting mostly of platelets, and these platelets will adhere only to injured site, and this will further reduce blood loss. Following factors are involved in the platelet plug formation when collagen fibers are exposed and chemicals are released from damaged cells. The injured endothelial cells will release von Willebrand factor, glycoprotein that binds to receptors on the surface of platelets, plasma membranes, which will demonstrate in a few minutes here. The exposed collagen plus the von Willebrand factor together make the platelets very sticky. So it's these actual exposed fibers that are going to cause these platelets to adhere to them. And what happens is the platelets will start to adhere to one another and the surrounding vessel walls. Binding of VWF and collagen to platelets triggers a series of events within platelets known collectively as platelet activation. The activated platelets will then release granules containing ATP, ADP, serotonin, calcium, and clotting factors, among other things. The exposed collagen plus VWF you'll have granule contents that will attract and activate nearby platelets, causing them to clump together or aggregate. The platelet aggregation forms the platelet plug, and this is essentially just a temporary patch over that opening to prevent any further blood loss. So here you can see, due to the exposed collagen fibers and VWF molecules, the platelets sort of adhere and they form this plug that you can see right here. Part 3 is coagulation. This is a process that forms the molecular glue. It binds the platelets, endothelial cells, and other formed elements together. This actually involves a cascade of blood clotting proteins, which proceeds down 2 pathways. We have the intrinsic pathway, which is contact activation, and the extrinsic pathway, which is tissue factor pathway. Both of these pathways, no matter whether they're started intrinsically or extrinsically, will converge at a common pathway that leads to the activation of fibrin. Fibrin is a thread-like protein that converts soft liquid platelet plug into more substantial solid mass. The fibrin is found circulating in plasma and in platelets in an inactive form called fibrinogen. Fibrinogen is then converted into fibrin by a series of reactions. This is part of that coagulation cascade. And this will occur at the surface of the platelets and or the damaged endothelial cells. Now the cascade depends on these clotting factors. These are proteins that are present in your blood in an inactive form. Mostly enzymes synthesized in the liver will circulate in the blood in that inactive form. Remember, all these are synthesized by the liver. And we had talked earlier in a earlier recording that people that have cirrhosis can actually end up with blood clotting issues. Clotting factors are labeled with Roman numeral in order in which they were discovered. So you'll see these Roman numerals, and also several of these, 2, 7, 9, and 10, depend on vitamin K for their synthesis. Now, the two activation pathways, you have the intrinsic pathway. This is named because all involved clotting factors are found in the blood. Pathway activation occurs in following sequence of events once inactive protein clotting factor 12 comes in contact with the exposed collagen fibers. The intrinsic pathway, you have those exposed collagen fibers activate 12 to 12A, factor 11 and 9 become activated, and then factors 9A and 8A along with calcium ions will form an enzyme complex which will activate factor 10 to 10A to complete the pathway. So here we can see the activation of these clotting factors by the intrinsic pathway there. I'm not too concerned you know the actual cascade, but just know the two main activation pathways here for the coagulation pathways. The second is the tissue factor pathway, or the extrinsic pathway. This is so named because it is initiated by factor outside the blood. This occurs simultaneously with the intrinsic pathway in the following sequence of events. Damaged subendothelial cells will display a protein called tissue factor. Tissue factor will activate factors 7 to 7A. Factor 7A, tissue factor, and calcium ions will form an enzyme complex which will activate that factor 10 to 10A, and 10 is your common factor there. And here you can see the extrinsic pathway. What's going to happen is when that factor 10A gets activated, you take prothrombin and you convert that to thrombin. Thrombin then takes fibrinogen and converts it to fibrin. And again, fibrin is forming that mesh that's actually going to form the clot there. The fourth stage of hemostasis is what we call a clot retraction. This occurs as coagulation cascade nears completion. The actin and myosin fibers are involved in platelets will contract and bring the edge of the wounded vessel closer together. Fluid consisting of plasma without clotting proteins is forced out of the clot during clot retraction. And here you can see the clot retraction. You're essentially just, squeezing up, tightening up, everything's sort of tightening up and tightening that seal up. The fifth stage is thrombolysis. This is a process that begins after injury has healed and blood clotting is no longer necessary. Fibrinolysis, this is a process that actually now starts to break down the fibrin glue, and it involves the following events. Endothelial cells release an enzyme called tissue plasminogen activator, or TPA. This will initiate thrombolysis, and TPA is essentially a clot buster. Some of you may have heard of TPA prior because this is something that's administered to stroke patients that have clots that are occluding blood vessels, especially in the brain. They can administer TPA, which will bust open that clot and sort of get blood flow back to those collaterals. TPA activates plasminogen. Inactive plasminogen is found in the plasma. It binds to the fibrin molecules as they are incorporated into the blood clot. TPA converts bound inactive plasminogen to active enzyme plasmin. The plasmin then degrades fibrin and the clot dissolves. The remaining components of clot disassociate from the endothelium, and the process is now complete. And here you can see the breakdown of the clot, especially after the vessel has healed, and you dissolve up that clot. Here's the overall picture of all the different events that occur for hemostasis. And these are all the clotting factors that exist. You do not need to know all these factors. These are just the factors that are identified. And again, most of these are actually synthesized by the liver. It is worth looking at their functions just so you can appreciate what all these factors are actually responsible for. Now, the regulation of clotting, this is something that has to be really controlled. Blood clotting is actually a positive feedback mechanism, and it's tightly regulated, okay? The actual thing that stops this are the anticoagulants that are present, and the anticoagulants will actually inhibit coagulation. And this is sort of that thing that's sort of intervening to stop the whole positive feedback mechanism. Here are some anticoagulants or clot blusters. You might have seen some of these. Again, we just talked about TPA, plasmin, you might have heard of. Heparin is a very common one. Protein C is another common one. Okay, and again, a lot of these can be administered. They can be administered externally to the patient to sort of prevent any clot formations. There are some clot disorders, and these clotting disorders are conditions in which clotting is not regulated properly, and they can create drastic consequences for maintaining homeostasis. There are two types of clotting disorders. You have bleeding disorders, and you also have hypercoagulable conditions. The bleeding disorders can increase blood loss even from minor injuries because the blood is unable to clot. This is usually due to clotting protein deficiencies such as hemophilia A, which is caused by a shortage of factor 8, and hemophilia B, which is caused by a shortage of factor 9. Hypercoagulatable conditions, this will result in the formation of inappropriate clots or forming what we call thrombosis. Clots or thrombus are dangerous. They can obstruct blood flow to the vessel. A thromboembolism, this can break off, and the thrombus can include smaller vessels downstream. This could be an issue if it actually causes a clot in, say, the lungs, the heart, or worse yet, even in the brain. These could all be very fatal issues if they're not resolved. Hypercoagulatable conditions, thrombi that form deep veins in the legs cause a condition called deep vein thrombosis. This is something that can occur, especially if you have somebody that's pretty sedentary and they're not really active. This can happen with a lot of older patients. One of the things that's very important is making sure that they get up and walk around and exercise a little. A pulmonary embolism, this is a dangerous complication of DVTs because what can happen is sometimes as DVTs can break off, the emboli will then travel in the legs and lodge in the small blood vessels of the lungs. And again, that can be a very fatal issue, especially if they're not able to break that clot up. The last topic that I want to talk about is blood typing and transfusions. Blood transfusions is when you take blood from a donor and give it to a recipient. This is commonly used treatment modality in today's medicine, but it wasn't always the case. The discovery of surface markers or antigens found in most biological molecules and all cells, including erythrocytes, leads to the development of safer transfusion practices. What happens is the immune system recognizes foreign antigens, and it responds by trying to remove them. The response was responsible for many fatalities in early transfusions. There are two types of transfusion reactions that we're worried about, the ABO blood group and the RH blood group. With the ABO, there are two types of antigens that are present, A and B. You either have one, the other, or both, or none, okay? And this is genetics. And if you have the antigen, you have that type of blood. So if you have the A antigen, you have type A blood. If you have the B antigen, you have B type blood. If you have both, it's AB. If you have neither, it's O. The problem with these antigens is that almost immediately upon, excuse me for a second. Okay. I'm just gonna go right here for a second. Almost immediately upon development, when you have your blood type, let's say you're type A blood, you have the A antigen. Your immune system is automatically going to make the antibodies for whatever antigen you do not have. Again, that's for whatever antigen you do not have. So let's say you're a type A blood. If you are type A blood, you're automatically going to make anti-B antibody because you do not have the B antigen. The problem with making those antibodies is that if you ever come in contact with that B antigen, you will have a transfusion reaction. So somebody that's type A blood would have anti-B antibodies. Somebody that's type B blood would have anti-A antibodies. Somebody that's type AB blood will have no antibodies because they actually have both antigens. And that's why they're often referred to as the universal acceptor. Somebody that has type O blood will actually be producing both anti-A and anti-B antibodies. And as a result, they will have a reaction. And although type O blood is the universal donor because it has no antigens, it can pretty much go to any patient. A type O person can only receive type O blood. Okay, and this is how we sort of do this blood typing to determine what is your blood type is they will actually take a blood sample, they'll just mix it with antibody. And if they see a coagulation reaction, clumping, then they know you have that antigen. If they know you have that antigen, you have that type of blood. So as you can see here in the type A blood, we see clumping with the anti-A antibody, but no clumping with the anti-B antibody. So if you look at this, you would conclude that this is type A blood. Okay. Now the problem with Rh factor, let's go back to the Rh blood groups here. Rh, this is actually, you're either going to be Rh positive or Rh negative. Now if you are Rh positive, you will not make antibodies. If you are Rh negative, unlike the ABO system, you do not automatically make those antibodies. You will only make those antibodies upon exposure to Rh positive blood. So the first time you get a pass. Second time, you'll have a transfusion reaction. This is typically an issue for Rh negative mothers who end up having a baby that is, or fetus that is Rh positive. What happens is during the first pregnancy, if the mother has an Rh negative blood and she has an Rh positive fetus, she's exposed to that Rh positive, which means that she will develop antibodies. Second pregnancy, if it's an Rh positive fetus, the mother's immune system will attack that fetus. This is something that can be prevented. There is a treatment called RhoGAM that is typically administered to Rh negative mothers, especially if the father is Rh positive, the baby could potentially be Rh positive. Okay. Let's see. All right, so just if you get a chance, look over the different blood types and these different transfusion reactions that can occur, and where you might end up seeing a transfusion issue if it should pop up. Okay, and again, just know like universal donor versus universal recipients. This table is excellent because it really summarizes all the different types of blood, whether it's AB positive, AB negative, A positive, and tells you which antigens they have, which antibodies they're producing, and what type of blood they can actually donate or receive. Okay. Also gives you the percentages in the US of the breakdown of how this is actually distributed. Okay. And that is it for blood. Have a good one, guys.